Hey y'all. So it is time to do an update, and I was kind of waiting. I know it's been a long time since I did an update, in fact, but July 15th was the anniversary of my end of radiation treatment. So that's an exciting milestone, and that would be 2 years, a 2 year anniversary. And I wanted to just jump on here and just give an update of what's been going on in really the past, I guess, 2 years, because I'm trying to remember exactly the last update that I did, and it was forever ago, maybe a year out. It'd been a year, and I was still cancer free. And same is going on now. There's just life, and life is busy and great and exciting, and I'm enjoying it so much. But what I wanted to just kind of give you an update medically of what's been happening. So since my treatment ended 2 years ago, I have been going every 3 months to see the oncologist as well as the colorectal surgeon, the person who found my tumor. And those visits at the colorectal office are always physical exams, and then the oncologist obviously does blood work and kind of just a check-in, looking at my numbers, just a general health, well-being, all of that stuff. So that's been good. We've been doing that for the last 2 years, every 3 months, like clockwork. And then they've all been really good reports. I've had a couple of scares, of course, and I think being a cancer survivor, we'll call it a cancer patient in remission, is technically what I am. There's always fear. And the Lord tells us, the Bible tells us many times over and over to be afraid. And so that's kind of what Michael and I have embraced over the past 2 years, is we just cannot continue to function in a spirit of fear. And I don't want to live my life that way, waiting for the other shoe to drop. So that's kind of where we've put that. That's just, we just don't go there. But I will say that sometimes there is like a cloud on the horizon. Like you can feel it kind of just back there. There's a little shroud, I guess, of just uncertainty. And the truth of the matter is, we all live in uncertainty, and tomorrow is not promised to any single one of us. And I always remember this conversation I had with my dear sweet friend Leslie, who passed away several years ago from metastatic breast cancer. She and I were having dinner, and I said, you just are so brave. You just are going on with things, and you don't even act like a person who is living in this situation that you're in. And she said to me, the only difference between me and you is I know what is going to kill me. I don't know when any more than you know when. And so I can't live my life as if this is, I'm about to die at any second. She said, I have to just live my life and enjoy it and get all the experiences I can. And she said, you don't know that when we walk out of this restaurant here tonight that somebody is not going to T-bone your car and it's over for you. We don't know. And so that's, something that I never forgot, those words that she said. I really didn't, because she's right. I mean, just because she knew at that time that she was on her final laps with cancer, and that she was no longer going to do any more treatments. And so she knew that her time was coming to an end, but she didn't know when. And ironically, her husband passed away 6 weeks before she did, a totally healthy man who had, same thing, didn't know that his days were numbered. He thought he was going to be here to bury her, and he wasn't. And so I think about them often, and I have thought about them often through this journey that I'm on, that neither one of them knew. And Jimmy certainly didn't know that he wouldn't be there for her final days, that she would lay him to rest first. And so when I think about them, it just reminds me to just live and enjoy every single moment that I can. So that's what we've been doing the last 2 years. And ironically, again, I've had some scares. I've had some irregular mammograms that I've had to do some follow up with, where you go and you have the diagnostic mammograms. And for those of you ladies that are watching this, you get it. It's scary when anything's not normal and they go, well, we're just going to watch it, come back in 6 months. And I've gotten a couple of those. And we go back in 6 months and they go, well, whatever we saw at that moment is just not there anymore. So, I answered prayer on that. And then we have had some scares with my weight, not understanding why my weight has just ballooned pretty much. But that being said, there are worse things. I have a good healthy appetite. That's one thing. And so I think just, menopause happened and all of this. And so I'm struggling with those kind of things and body image and things like that women tend to struggle with. But, it is what it is. And we're just going to keep rolling on. And then last week was July 15th. And again, that was the 2-year anniversary of the end of my radiation treatment. And ironically enough, I was in the hospital July 15th under having another exam under anesthesia because the colorectal surgeon on the last exam was uncomfortable with some things he was seeing and decided that it was time, that it was necessary for me to be put to sleep, and he was going to biopsy some things he was seeing. So we spent a lot of time in prayer, and so did a lot of people that love us and my church and coworkers and friends, and who just prayed and prayed for me and prayed that this would be nothing. So that was July 15th. And then it was a wait on the pathology results. So last night, July 19th, 2021, I received a call from my surgeon who said the first sentence out of his mouth was, "Stephanie, it's Dr. Katz and you're fine." And then he says it's not cancer, but it is still something we need to watch. He said it was dysplasia, which if you look that up, they're irregular cells. And if you've ever had ladies, if you've ever had a irregular pap smear, you've had these dysplasia where the cells don't look right. They could develop into cancer, but probably won't. And I've had that happen before in my life, and we're just gonna go with that's an answered prayer. It wasn't cancer, so we're moving right along. I also, in April, I had a CT scan, a contrasting CT, and I have those every 6 months still. And I have not had another PET scan or MRI, which people tend to ask me about, but they're monitoring with contrasting CAT scans. And in April, I had one, and they saw some what they're called nodules in my lungs. They're in both lungs, upper and lower portions of my lungs. There's about 7 of them that are scary. They don't know what they are. They're just, when you are told at some point in your life you have spots on your lungs, this is what they're referring to. There are nodules in there that could be any number of things. The CAT scan, the radiologist's opinion on the CAT scan was that it is metastatic disease. Those are the terms he used based on my history. However, my oncologist said he's not ready to use those terms. And because he said that you can have things like that in your lungs, they call them nodes, nodules, whatever. They can be pus, they can be bacteria, they can be cancer. There's no way to know without further screening. And the next screening would be PET scans, MRIs, and a biopsy, a biopsy of your lung, which I have no idea how they biopsy something out of your lung. I'm not sure I want to know at this moment. But the spots are so small, the largest being 5 millimeters, which is, I guess, the size of a BB. I tried to kind of look it up on the ruler, and millimeters aren't my thing, but it's very small. And they cannot biopsy or PET scan anything smaller than 9 to 10 millimeters. So technically, we're just sitting in wait, and that's been since April. I actually have another CT scan scheduled for July 27th of this month. So that's a week from today, actually. And I will be going and having that contrasting scan done. And then I have an appointment with my oncologist on August the 3rd. Basically, we're just monitoring and praying. And I know that the Lord is a great physician because I just got healed again. And I know it's possible, and I live in that every day of my life. So I just wanted to just pop in and tell you, never give up, never surrender. I am still doing good. I'm still in remission, technically, because we have nothing but to watch and wait. I'm still going every 3 months for my exams. I'm in no pain. I'm having no symptoms. We're having a great time and doing a lot of work and fun things and building things and doing crafts, and I'm excited about all of those things. And also, we are loving on and enjoying our 3 precious grandsons, and we have 2 more little grandchildren on the way that should be here in November. Another little boy and a baby girl. So we're looking forward to spoiling her rotten as well. I love you all. Post in the comments if you have any questions, and just watch and subscribe if you want to get more updates from me, and hopefully I will have some good news by the first week of August. All right, bye. Mwah.